your Planned Parenthood, is abortions like, is this, I feel like when people think of abortions, like they think there's just like a mass lineup of people like waiting outside to get this done. And, just a bunch of like, I'm sure this is a huge emotional and very, I mean, a lot goes into this, right? And so is it common? Is it not common? And maybe what's your experience with that in general? Cause I have no idea, to be honest with you. So I just want to get your take on it.
Yeah, yeah. So for us, in terms of revenue, it makes up about 5 to 10% of our revenue every year. So
Hmm.
it is a small portion of our revenue. We offer many other services in addition to abortion. So for a typical day in our clinic, we actually see patients for whatever they need, kind of all embedded into the same clinic. Meaning, if you're sitting in the waiting room at our clinic, you could be there for the abortion pill, you could be there for birth control, you could be there to get an STI check. It can be anything. And I would say, like, looking at a common schedule for us. So if our clinicians see 20 to 30 patients a day, there's probably 4 or 5 abortions in there, but
Hmm.
there's a lot of other stuff going on too. Um, so did that answer your question in
Yeah, it
terms
did.
of
And I was
the
going to ask, do
percentage?
you have a lot of people changing their mind? Like, do you have more people coming in and like just asking questions and more of like, I was thinking about it, but I don't know.
I think that's a great question. So I would say my answer is going to be annoying because I'm going to say it's so individual. And
Yeah.
that's how we approach it is every single person who comes into us with a positive pregnancy test, the first question we ask is like, how is this for you? Like, tell me what you're
Yeah.
thinking. Tell me what's going through your mind right now. And we spend a lot of time training our staff how to do really good, objective, but compassionate counseling around what options folks have.
Mm.
And so we spend a lot of time, going through like, here are the options. Continuing pregnancy is an option, adoption is an option. And then these are your abortion options. And sometimes people say, I would say, no two people are exactly alike. Some people, and I think one of the things that I like to break down is that this is a really difficult decision for everyone because it's not.
Of
There are
course.
some people who come in and say, I know I can't be pregnant right now. This is not a possibility for whatever reason that's happening in their life. Their mind is made up. They've resolved it in their own mind and they do it. They move on.
Yeah.
It doesn't have to be this big emotional burden. For
Do you, s-
some people, it is, though. Certainly, for some people who have more conflicted emotions, and probably the thing I say the most to patients is this can both be the right decision and also one that feels sad or feels like you have to mourn it a bit or makes you feel angry. Or I always joke because the pregnancy hormone makes it feel like it's very hard to control emotions at baseline. I'm like, it can feel like all those things at the same time and still be the right decision for you.
yeah.
Um,
Do you
yeah,
have people set in place for emotional counseling there on after, or is that like, are you working with like another clinic or something?
we work with community partners for that. We don't offer counseling on site, but we do connect people with community resources. And there's actually this really fantastic organization called Breathe, and it is both phone and telehealth setup. And it's basically it's both the accessing like licensed counselors and therapists, but then also being able to just talk to somebody who's gone through a similar experience, like a peer-to-peer session too. And that can be really beneficial for a lot of patients. So we connect a lot of folks with Breathe. That's a very helpful resource that we use for a lot of folks. But I also want to disavow that, like, everybody walks out of here needing counseling because a lot of people don't. And most of the people who I feel like maybe we really want to connect with counseling, it's usually because of the context of everything happening in their life that have led to this situation where they can't be pregnant right now.
It's not
Um,
one thing. It's kind of just a collaboration of different things in their life.
exactly. And so, um, gosh, especially in this past year when we're all trying to accommodate, totally throwing our lives upside down. And, most of the people that I meet are already parents too. And they kind of know what they need to do to be a good parent and recognize, holy crap, I got to prioritize these kids that I've got right now. And sometimes that means making a really difficult decision or going through something that's personally painful. but really prioritizing those kids that you have already, and going, phew, my resources are expended with what I'm dealing with right now. And we also, I would say it's not uncommon, and I provided abortion care yesterday, and had two patients who are, in the middle of a really difficult domestic violence situation. And I would say,
Mm.
it's not like every abortion I do is associated with domestic violence, but that is a theme where people are going, I've got to make sure I'm safe, right? And I'm taking care of myself in order, to take the next step in life to do what I need to do.
Well, one thing you said that was interesting was that a lot of people are mothers. Is that the most common patient population that you're seeing? That usually they're already mothers who are coming in, or because when I originally thought of Planned Parenthood, it was always just like young girls who, maybe,
Mhm.
something happened to them, whether on purpose or not. Those are the people getting the abortions, but is it mostly just parents already, or what? Maybe you can speak to that.
I would say over 90% of our patients are already parents.
Interesting.
Yep, yep. We do obviously see folks in the 15 to 19-year-old age group. Oh, gosh, I'm sorry, I can't tell you exactly what percentage of abortions are in the 15 to 19-year-old. But if we take like yesterday, for example, I think I did like 18 procedures, and I think two of them were between 15 and 19. So I would
Mm.
actually say the vast majority of people that I take care of are like 20 to 40. And I actually I did an abortion yesterday on a 42-year-old. So it just
Wow.
also goes to show, um, I do abortions on grandmothers all the time. That comes up all the time. And they're like, like, I'm a grandma, I can't do this over again. I'm not starting all over again.
Yeah.
Um,
Right.
yeah, so it really is across the board. It really is, which is to also say a lot of people are coming into abortion for very different reasons too. So, I've met a few folks who know that maybe there's something wrong with the fetus and that it's not going to turn into a healthy pregnancy down the road. And this may be very well a desired pregnancy, but it's not a healthy pregnancy. And so, I've definitely done quite a few of abortions for that indication as well. So it really is across the board. But I would say the vast, vast majority of people that I take care of are already moms. They know what they've got to do to be a good mom, and they're saying, you know what, I've got to prioritize the kids that I have right now.
And do you need parental consent for an abortion?
That's a state-based answer. So
Okay.
in New York State, no. In New York State, a pregnant person is considered an emancipated minor, so they're able to make their own medical decisions, which includes abortion and contraception care.
Okay.
That is a different answer in different states. And so I will say, for example, the answer in Ohio is no, they can't make that decision by themselves.
Hmm.
And so we see a lot of patients who drive to us from Ohio, because actually Western New York is not that far from Ohio.
Mm-mm.
Um, very far from New York City, who, for those of you who think I live close to New York City, but so we have a lot of young folks who drive from Ohio to us
Oh,
because they
interesting.
would need their parents' consent in Ohio, but in New York State they don't.
Interesting.
Yeah.
That's
But it's also really hard to pull together cash and a car to be able to drive 2 states away to get an abortion
yeah,
too. So
monetarily
especially when
wise,
you're
what do we look like? What is it like? I mean, I'm sure you have people who can't afford it and or are uh, tight on money or whatever. What is the situation with that? Is it insurance based? Is it I don't understand it. So
yeah, absolutely. So I'm sorry, in New York State,
yeah.
if you basically don't make more than like $3,500 a month, you qualify for our emergency family planning benefits program, which is part of New York State Medicaid. So
Hmm.
if you are a New York State resident and you make less than like $3,500 a month, I don't know exactly what the threshold is, but it's like pretty high, frankly. Like, a lot of people fall under that.
Yeah.
Um, you automatically can get this emergency Medicaid program, which covers both abortion and contraception. So for folks in New York State, that is an option. Sometimes teenagers even use that emergency program when they don't want to use their parents' insurance, if that makes
Mm.
sense.
Yeah. Yeah. Yeah.
You can actually enroll them in this emergency Medicaid program, so no statement gets sent home saying, your son or daughter was at Planned Parenthood and they had these services done. So in New York State, for New York State residents, we are pretty darn lucky. And unless you're making like more than 80 grand a year, we can pretty much get you onto Medicaid and cover your abortion and contraception.
Interesting. And so we're talking about, no, go ahead. You want to finish the
And
thought?
then, but if you're from out of state, you do not qualify for those programs. And depending on your insurance, it may or may not cover abortion. It's plan dependent,
Mm,
insurance dependent. Sometimes that comes down to state law. Most insurance plans in places like Mississippi do not cover abortion. So if you're from out of state, you might use your insurance, you might not. And then if not, you pay out of pocket. We do have a sliding scale where we look at your income and we slide how much you owe based on your income. But it would then be an out of pocket expense, which I think is around $400 at our affiliate for the in clinic surgical abortion procedure or a medication abortion.